Healthcare is changing, and Dr. Nancy RN is here for you. The topics are many, but each program stands on its own with 3 key action points for you to learn. Your guide to a healthier you in a changing world. Dr. Nancy RN.
Welcome to Dr. Nancy RN, Healthy You, Healthy Nation, Healthy World. I'm Nancy Valentine, PhD and registered nurse, and this show is dedicated to you, the healthcare consumer. And today we have a very special guest with us from Drexel University School of Nursing, and I'm going to introduce her in a moment as we talk about a very interesting topic that I bet will be news to many of our viewers. Her topic is A Consumer's Guide to Moral Courage, a necessary ingredient for patient safety and quality care. And I'd like to introduce Vicki Lockman, who is a friend and a colleague of mine. I want to tell you something about her really exemplary background. Dr. Lockman received her first degrees from the University of Pennsylvania. She has a baccalaureate degree in nursing, and she got her master's in psychiatric nursing. And then she decided to go on and get an education degree, a doctoral degree from Temple University. Then she completed a master's in bioethics at the University of Pennsylvania with a focus on the ethical issues at end of life, especially with end-of-life care planning. So with that background, Dr. Lockman has been a national and international advisor to many organizations. And for the American Nurses Association Center for Ethics and Human Rights, she serves on the advisory board. She has also worked on helping to revise the Code of Ethics for nurses, which is really something in nursing that we are very aware of, and every nurse is expected to understand and know the Code of Ethics. She has authored over 100 publications and a number of books. Her latest book is Ethical Challenges in Healthcare, Developing Your Moral Compass, which is a guide primarily for healthcare professionals. In October 2011, she was inducted as a fellow in the American Academy of Nursing for her pioneering work in ethics. So thank you, Dr. Lockman, for being with us. It's really a pleasure to have this opportunity. Now let me just say our title again, A Consumer's Guide to Moral Courage, a necessary ingredient for patient safety and quality care. I would think that most people would not understand moral courage, and from a consumer's perspective, why it's so necessary for people to understand what moral courage entails, because obviously you want them to practice it, and that, I assume from our title today and what we're going to be talking about, will contribute to their safety and to their quality of care in any healthcare situation. Is that correct?
That is correct. The easy definition of moral courage is the willingness, the ability and willingness to stand up in places where, in fact, every force around you would have you not speak up. And so it's not speaking up without fear. You feel the fear, but you speak up anyway, whether you're advocating for a family member or you're advocating for yourself to have better and safer health care.
Right. But in terms of like the day-to-day world that most people find themselves in healthcare, whether it's in their primary care doctor's office or they're in a hospital or they're in a clinic, how would they start to learn how to use moral courage? I mean, they may have questions, they may be intimidated. How do people learn this? This is skill.
It's both an attitude and a skill. And what I've done when I started out teaching healthcare professionals moral courage, because what I was hearing from healthcare professionals was the significant amount of moral distress that they were experiencing, moral distress being that they were not able to do the right thing in situations. And then I thought, well, the consumer really needs to have this self-advocacy too. And there's certain skills that they would need. So I developed an acronym to help people remember all the things that they need to remember in demonstrating moral courage.
Okay, well, tell us about that. What is the acronym?
Well, it's making it easy to remember. It's CODE, C-O-D-E, and the C stands for courage. you know, the initial work on courage was really about physical courage. You know, the Aristotle, Plato, Socrates was about physical courage, but moral courage is more standing up in what we call ethical problems. Like for a consumer, it might be that they're going to have surgery, and in fact, they're not really clear about all the options, but yet they don't ask. They get that white coat syndrome, and so they are making a decision without full informed consent, and they don't advocate for themselves. That's a lack of courage to potentially get the white coat upset with them. It could easily be advocating for a loved one where someone's not following their advance directive in the situation. So these situations require courage. But what stops us is that we have to know what our obligations are in these situations. If I was your surrogate decision maker for you, as my sister perhaps, I have an obligation I've taken on there. And to meet that obligation, I have to have the ability to manage the danger in a situation, because the danger in a moral courage situation is ridicule, it's a loss of standing, it's being made fun of, it's being put down. So it's more on an emotional level with moral courage. And I can talk a little bit more about some of the strategies to manage that danger, but then the E is the actual expression of the words that you would need to use. So that's going to require assertiveness, negotiation skills. So you can see there's some skills that go into having moral courage.
Well, this is very interesting because I'm thinking about how, again, regular people going to see a healthcare provider or being in a situation where they do have questions or they are very aware of their fears. But what you're telling us using this code is that they really have to hone their communication skills so that they can really move from just having a question in their mind but leaving and not asking it, or having a question in their mind and leaving because they are anxious. I think you should really define that white coat syndrome, because I bet a lot of people don't know what white coat syndrome really is. So tell our audience what that entails.
And a lot of times a consumer, and I see this much more in the elderly than I do in the young people today, but still they see this white coat and they don't feel comfortable asking questions of this authority figure. Right? They take what they say as the God's honest truth in the situation. And they might be intimidated because of the authority that they delegate, they give. They give over their authority to this person with the white coat. And that's what we often call the white coat syndrome.
Okay, well, we've got that down. But moving into how to take that courage and move it into a conversation. When you say white coat, I think a lot of people think that the physician in particular, or anyone that is an authority, because a lot of people wear white coats, it's not just physicians, that they do have their best interests at heart and that they are going to make the right decision. So you're suggesting to us that we really use our own intelligence and feel like we're having a conversation more as equals with these folks, rather than the person with whoever that might be with the white coat is up here and you're down here somewhere. So is that part of this whole?
Yeah, it's really more today a shared decision making. It's that we need to have a partnership, whether it's with an advanced practice nurse or a physician or even our pharmacist. It's a partnership to keep us healthy and safe. So that sometimes we have to risk looking stupid. Because the question we ask, somebody may actually indicate that we should have known that answer, or why would you even question me? But we have to have the courage to say, now wait a minute, I really don't understand what you're saying. You know, unfortunately, I think healthcare professionals do have the best interest of their patients at heart, and sometimes they use a lot of jargon, so that the consumer doesn't really understand. I've had more than one patient turn to me after doctors talked to them and said to me, "Nurse, am I going to die?" Because they were so confused by what, in fact, the person had said,
Right,
that
right.
they didn't understand.
Right. So I think what Vicky's telling us is that rather than wait, like in that scenario, for somebody else to interpret what someone else said to you, that you, because you have a question in your mind, should feel empowered to feel that you can ask that same question back and ask for clarification. So that's the courage part of it. It's really saying, I have the ability, I have the intelligence. If I have a question, that's all I need, is to really have that question and then really proceed. Okay, so take us through the rest of it again, the O again.
The O is your obligation. So if I have a child, I have certain obligations I've taken on as a parent. If I am a proxy decision maker, if I'm the guardian, and then I would also encourage the consumers to really look at what are your obligations to yourself, right? I just saw a patient this morning and it was very clear. She said, "I'm a chameleon." And I said, "What does that mean?" Well, she says, "I'm a very adaptable." I said, so if I said, what restaurant do you want to go to for lunch? She'd say, I would say, "I don't care." And I think sometimes people go into to hospitals. Well, whatever you're going to do, it's okay. But that's not demonstrating the self-respect and the self-advocacy that you need. So that's the O. The O is your values and your obligations to yourself,
Right.
and to the other people in your life.
Right. I think that's another good tip, because the obligation, especially if you're dealing with other people, sometimes it's harder to do it for yourself, or for some people it may be easier to do it for themselves. But when you have another family member, you are going to be involved in that care somewhere along the line. So understanding every piece of the puzzle and really, again, asking for everyone to be part of that conversation is a very realistic thing to be doing, right?
Absolutely. In an intensive care unit, for example, 86% of the decisions that are made by families. So you have to know what your family member would want. What are your family members' values? So that you can, in fact, have the moral courage to stand up for that family member in situations where somebody might want to be doing other kinds of interventions that you know that your family member, because you've had those kinds of conversations,
Right.
would not want to have.
Right. Right. Well, you being an expert in end-of-life care, would be very, very knowledgeable about that. And that has been a theme of some of our discussions on how best to handle end-of-life decision-making. But I think that this is just another reminder that that obligation really does help in terms of interpreting when necessary what other people need, want, or desire, or value, as you said. Values are very important.
Yeah, the best thing that any one of us can do is to make sure that our proxy decision maker understands what we would want in those situations, because other studies have indicated that up to 96% of people, if they don't know what the individual would have wanted and they were put in a position to make decisions, have post-traumatic stress disorder. That post. So what we want to do is to help the consumer do the D part, the danger management about speaking up. And the danger management involves three things. One is self-soothing. Okay? The quickest way to self-soothe is to deep breathe, okay? Because you cannot deep breathe and feel anxious at the same time. It's physiologically impossible. So you can deep breathe to kind of calm yourself down. Okay, I'm going to ask this question. Right?
I may be sweating, but at least I'm breathing.
That's right. That's right. That's right. Yeah, I mean, there's many times, my stomach is turning over, and but I'm still going to speak up in that situation. The second one is what we often call cognitive reframing. Okay? That if I'm telling myself I have no right to ask this question, I'm not likely to ask it. Versus if I'm telling myself I have a right to ask this question, I have a right to ask what the risks and benefits are, I have a right to say I don't really want to go on drugs, I really want to manage this in a different way. I have a right as a consumer to really voice that. And then the last one on the danger management is to increase your ability to take risks. Okay? You and I are big risk takers, but not everybody is a risk taker. And so how do you increase your ability to take the risk at this person's displeasure? Well, one of the things is to know that is to think through, and what's the worst case scenario here? What's the worst thing that could happen here? They wouldn't like me. Maybe they'll even throw me out of their practice or something. Or what's the worst case? And because you've got to be able to deal with the worst case before you're going to have the courage to speak out there.
Right. So these three techniques, the deep breathing, the second one was the cognitive reframing. That's another big term. But tell us again, it's always good to repeat these things. Cognitive reframing is what?
It's changing how you think. So if I'm thinking, wow, I'm not really very good at this, you're going to act differently than if I'm saying to myself, now I can handle this.
Right. So you're giving yourself positive reinforcement in your mind.
Changing. It's what I say to people, it's like you have a radio on in your head. And if you don't like the song on the radio, you can change the channel. You're in charge of changing that channel.
Right. Okay. So that's good. And the third technique again
is increasing your risk taking.
In general.
In general, yeah. And there's some strategies to do that. Worst case scenario is one of them. Asking somebody else their opinion who's not involved in the situation. Get third party opinion.
Right.
You know, a second opinion we often talk about in medicine. But it's getting somebody else's opinion. Making sure that you can deal with the consequences.
That's very good. I think these are really good tips for any kind of difficult communication. So I think they're very good and definitely worth repeating as takeaways, for people to use in a lot of tough situations.
Yeah, absolutely. Not just in healthcare.
Right.
It could be dealing with your daughter-in-law or whatever the situation. That might require more courage too. So it's being able to look at in these situations. I call them crucial conversations. And a person wrote a book much smarter than me on that subject, and I'd highly recommend that book if you're feeling like the E part here, the expression, is really where it's most problematic for you. That particular book, Crucial Conversations, helps you to know what to say in situations.
Right.
So that if he says X, I'm going to say Y.
Right.
And having that.
Okay, and a lot of that really boils down to not overreacting to a lot of the conversation. So tell us a little bit more again about the E, the actual expression. So, okay, you've thought about it. You said, okay, I've got courage. I'm going to do it. I have an obligation to myself or to others. I have the techniques. I'm breathing. I'm giving myself positive reinforcement. I'm really going to go for it. And then what with the expression? Give us a few, some of the subtext to the expression. How do people get it out there? I think what would really help, Nancy, is that they have some sense of what they're going to say when they're walking into difficult situations. Okay? And what might be difficult for you might not be difficult for me, and vice versa. So it's like you have to identify that this is going to be a difficult conversation to have, and to do a little pre-planning. And because the last time I brought up questioning the doctor around these medications, he really seemed upset with me. So I know that might happen now. So I'm going to have to what will I say? And so I often say to people, just say, this might be a difficult conversation for us to have, but I really think it's important that we have this kind of conversation. Because see, assertiveness is an honest, direct, appropriate response to someone. Right.
And it's a direct response to the question or to the problem.
Very good.
And I always loved Webster's definition of a problem. According to Webster, a problem is just a question unanswered. And so when you have a question unanswered in your mind, you have a problem, and so you just need to get the answer to that problem.
Very good. So when you talk about it, it really sounds quite doable, and that people that are listening, they could be framing this in their healthcare situation, or as you said, in other situations that are also very challenging, and they could use this code approach to really moving past that hurdle, or really addressing something that maybe has been thought about, or you've been ruminating about it and worrying about it, and then just say, you know, I'm really going to finally do it. I'm going to really take this on.
Absolutely. And I think you're right. It's not just healthcare situations, though that's what we're here to talk about, but it could be any situation that we find ourselves in where, and I think you used the right word, ruminate about. If we're ruminating about something, that's a problem. And we need to clear it out of our head and be more present.
Right.
And I think that, you know, learning, and the good news is every time you act in an assertive way, the next time gets a little easier because it's practice.
Right.
You know, because I didn't grow up being assertive. I had to learn to be assertive. I had to learn to practice and to ask questions of healthcare providers.
Right. Well, give us some examples. I mean, with your work, are you working with consumers in any way to really help them gain these skills? I mean, with your work with health professionals, which we know is really renowned, but how about with the consumers? Because this is really the next step, is really helping people to be able to take better care of themselves. And what you're telling us is that this communication is a vital link to that whole process. Without the communication, it's hard to get to the next step.
Yeah. I mean, I think the Institute of Medicine study really pointed to the importance of the consumer having the responsibility also. We as healthcare providers have the responsibility for patient safety and quality. But for example, say you're in the hospital with your loved one and they've had surgery and somebody walks into the room and you can see that they didn't wash their hands or they didn't use the gel machine. Okay, so what is your obligation in this situation? Well, your obligation is to not let them touch your family member.
Right.
Until they've gelled or washed their hands. So that's a simple thing. And if in fact, I always say, until you're conscious, you have to have somebody else there watching to make sure that those kinds of things get done. Or in fact, say you were told not to get out of bed and ring the buzzer before to go to the bathroom. Okay, well, and you've always been really independent, and you're not going to ring that buzzer. You're going to get out of bed and go to the bathroom, and I can tell you the chances are you will fall. So that's not taking good care of yourself. It's knowing when to depend and when to be independent. And there's at some point you will be getting out of bed. But I think the obligation to take for your own safety in that situation would be to push that buzzer and get that nurse in there to help you get to that bed.
But, you know, I'm thinking about the practicality. I mean, we certainly have some institutions that have phenomenal environments. It's a very positive experience to be on a particular unit, on a particular service. But there are also very many organizations or places that can be extremely intimidating. So it really may take more than just the patient or just one family member to really mount that challenge and really go beyond even the most immediate questions about care, but really maybe even the environment and how it is maybe not supporting that person who's there.
One of the things that I'm often struck by is how patients aren't aware that they can call an ethics consult. The healthcare providers can call an ethics consult, but every patient is also entitled to call an ethics consult. And if a patient feels that they're being treated in an unethical way, you know, they can call an ethics consult. I'll never forget the story where this woman called 911 from her bed because she couldn't get anybody to come to her bedside in that particular hospital. So she called 911, and the ambulance showed up at this hospital, very confused by what was this all about. And she said, after I pushed the buzzer 10 times and nobody came, I picked up the phone. And I say, good for her.
That must have really put everybody on notice around their patient satisfaction scores.
To say the least.
Really? Oh my goodness.
Yeah.
So tell us about what you're doing with real people in real situations.
Well, as I said before, my primary contact is really with healthcare professionals, but with the consumer, it's primarily in a support group that I run.
Oh, tell us about that.
Yeah. Well, I have done some secondhand smoke advocacy in my life, and so I got involved in for kids, teenagers, helping teenagers not to smoke or to stop smoking. And so helping, and talk about moral courage. We can all remember our adolescence and not being part of the group, and helping them to advocate for themselves, and how to say no in those kinds of situations.
Oh, that's interesting. Now, why did you choose smoking of all things?
Well, I got involved in looking at it in my community where I was living, and I realized there were over 400,000 people that died every year through secondhand smoke. And so, I started to look at, well, how did this happen? And that's when I realized that maybe we needed to clean up our restaurants, and then it got me involved in when did I start to smoke? I was a teenager. It was teenage pressure. And that's when I started to get involved with the teenagers. And then it went to now kids are smoking younger than that. So happily I don't smoke anymore. That ended many years ago, but helping people stand up for themselves, and that's where it started for me.
Right. Oh, that's very interesting, because that obviously was a major community service that you were providing. And tell us about how that worked with the adolescents, because I think, again, there are so many lessons here that our viewers could use for many other situations, not just, as you said earlier, in a healthcare environment. But maybe you could tell us about how the adolescent group that you were running responded to your code and to your support that you were giving them.
I think that we did it in skit format, because for kids, you can't lecture at them. You really need to. So we created skits so that they could actually see how to say no in the situation, or how to divert the attention away from you calling me names because I won't have a cigarette. And how could they cope with that kind of. Well, the danger for them was the lack of ridicule from their peers.
So if they didn't smoke, they just felt like they would be seen as outsiders and they would be ostracized.
Yeah, and so being able to stand up for yourself and not go along with the group. We would do role plays, and so that would help them have the words when they got in the situations. And it's just like I was helping my client this morning. I was giving her words, and so my deal with her is that once a day she's not allowed to say, it doesn't matter, I don't care. Once a day, that's all I ask, that she had to say, when somebody asked her what she wanted, she had to say, it doesn't matter, we can go to any restaurant. She has to say, no, I would like to go to.
Right, she'd have to make a decision and assert herself for something.
She has to
very
practice
basic.
that assert.
Right. It's a practice.
As a practice. And guess what? You can practice your assertion with your cousin, and that will help you in the doctor's office.
Right, that's true. So it's really a fabric that you want to build around your entire life. Was there any way of measuring, by the way, how the adolescents responded?
Yeah, well, we did. It was a while ago now, but we did. It was a very successful program in terms of them not smoking. It was. I forget the percentages, but it was high. It was a very high.
So you were surprised yourself?
Yes, I did.
That's great.
Yeah,
and I think that what you did was you gave them skills that they could use in multiple situations, not just around, I'm not going to smoke a cigarette. It's more universal.
It's the same thing we do with girls around sex. That's the same kind of training they're teaching young girls now. On how to say no.
Right, just say no. I think wasn't that Nancy Reagan, just say no? Well,
yeah,
you've got an actual technique that it really backs up and really helps people to go beyond just say no, but actually know how to really do that and be successful in doing it and really make it stick and make it sustainable. Well, Vicki, you've certainly educated me in terms of the Consumer's Guide to Moral Courage. I think that this conversation, along with many of the others that we've had on shows that have dealt with similar problems, really, again, puts the ball in your court as a consumer. But we're not just throwing the ball at you, we're giving you the ball with some direction. And hopefully you will be able to practice on your own. And we'd love to hear about your success. Thank you very much for being with us, Vicki. It's been a delight to have this time with you. And thank you very much for watching the show. Have a wonderful day. I hope you enjoyed our conversation today and that the information will help you in meeting your health goals. Catch this program and other conversations on the website, drnancyrn.com. Or you can write to me as well. I welcome your comments and feedback. Thank you for listening and join us again. And remember, with health, all things are possible.